Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with this edition of the Dr. Bob Rakowski podcast. I am thrilled to share with you Dr. Jarod Burton. He and I have been connected on Instagram, sharing some conversations. We have a very similar background. We have a passion for health and human performance. You take it from a kinesiology, neurology, functional medicine standpoint. Let's talk about your journey. First and foremost, welcome. And how did you get on this path? Was there some tipping point for you?
Yeah. Thank you for having me on. I appreciate it. For me, the biggest tipping point ever was, I was an athlete, and the only sport that I was good at was baseball. And I ended up playing in college. But before that, when I was 12 years old, I would have excruciating back pain. And no 12-year-old should ever have excruciating back pain. And so that led me along just a journey of trying to figure out what is going on, because I went to PTs. I was actually even told that chiropractors you stay away from, so I didn't even mess with any of them. I would just mess with PTs and different medications, and that didn't help. And then when I got to my college career, I was still always injured. Just had muscle strains. Just felt like I was playing my entire career injured, and I felt like I could have performed a lot better, but I just felt held back. And so that led me into actually just discovering what we call long duration isometrics. And where I found that out is I actually took a road trip around the United States visiting people. And so I would go to sports complexes. I would, meet with people that would do different reflexology type stuff. And I came across a guy who kind of developed what they call long duration isometrics. So essentially what that is, you hold a position for 5 minutes. So you hold a lunge for 5 minutes, you hold a wall sit for 5 minutes, might be like a push-up for 5 minutes. And I got back from that trip, and I was still in excruciating back pain. And I decided that I was going to deadlift. Okay. And so let me back up first. I couldn't deadlift without pain. So what I did is I took 2 weeks, and I did 2 weeks of just these long duration isometrics that I kind of learned. After 2 weeks, my deadlift that I haven't performed that was in pain, it went from 465 to 515. And I didn't even lift weights. All I did was
How big are you, Jarod? Because that's a heck of a deadlift.
I'm about 6 foot. At that time, I was probably right around 195 pounds.
Okay. And an elite baseball player. Okay. So you got that crazy core strength.
And so, I opened my eyes. I was like, I didn't lift a single amount of weight, and all of a sudden I'm lifting heavier. So what is going on here?
What isometric were you holding? Because everybody's going to want to know that. Was that a wall sit? Was that a lunge? What was it? What were you doing?
Yeah. So at that time, I didn't fully know what I was doing, but I would hold kind of what we call a single leg raise. So I'd stand on one leg, and then I would bring the other leg. I don't know how to show this, but I'd stand on one leg, and the other leg goes up and down.
Knee, or was it a straight leg out?
No, I brought it up to hip flexion at 90 degrees.
Okay.
So I'd hold that for 5 minutes. I would hold a lunge. We would work on a hang. I also did stuff with like shoulder internal, external rotation. And then there's, are you familiar with like hip cars, FRCC or anything like that?
I don't think I am.
The concept is to move your joints slowly through a range of motion. So let's take, your shoulder, your hip. It's a ball and socket joint. So the goal is that you slowly move your shoulder in all ranges of the joint. And that just supposed to help increase, range of motion, decrease pain or whatever. So there's an exercise on there called like a hip 90-90. And essentially you kind of sit on the ground. You have one leg that's in front of you, and you lift it up, and then you lift up your back leg, not at the same time, but you lift your front leg up, hold it for 5 minutes, and then you lift up your back leg. So the goal is to target hip internal and external rotation.
Who in the world can do that for 5 minutes the first time? I'm just curious, because listen, I've tried long hold isometrics, and at 2 minutes, I'm screaming for a break. Everything hurts. I'm dripping wet with sweat. I mean, how hard are people holding this in 5 minutes? 5 minutes is world class. That's not a walk in the park.
No. And I'm not, it's not like I held the 5 minutes the whole time either, but what I would do is I would immediately get back into it. And so I would not allow myself.
You hold as long as you can, break, recover, hold, and then it's a 5 minute with pauses set.
Yeah. The idea is not to rest. And that's how I did it at first. I have a little bit different perspective now that we can get on in a little bit later maybe. But so I just did like kind of those movements, and what I interpret from it is essentially I just strengthened my hips. That's all I know I did. I strengthened my hips in a way, and potentially maybe I lengthened some fascia out, or I reset some muscle spindles. Like I did something, but ideally, end goal, I just strengthened my hips. Next thing you know, I was much stronger. I was pain-free. And I was like, holy cow, where was this my entire career? And then I just started diving down that. And so I ended up in a sports training facility in Springfield, Missouri. And I was doing strength conditioning with people, and all my athletes, I had over 100 high school baseball players, and they're always coming to me injured. And so I would have a table, and ironically enough, I bought a chiropractor table off of Amazon because it was the cheapest one. And I had still no concept of what a chiropractor is. But I learned some kind of systems called like reflexive performance reset and square one. So I had this kind of idea of different neurological background. So like kind of those are based off of Chapman reflexes, which is the RPR, and the square one is more based off of like gait. So kind of how does your muscles move? How do your joints move during the gait? And then you kind of find a dysfunction there. So I was kind of exposed to a little bit of those avenues. I would work on those kind of techniques with my players, and they would get better. And then within 2 to 3 months, it was like I didn't have anybody lying down on the table or doing any sort of rehab work. And then that led me to finding somebody who was a chiropractor who focused in neurology. And next thing I know, I was like, I need to leave the sports world and I need to go back to school.
Yeah. Well, how interesting, right? Because the chiropractor that specializes in neurology is my neurology go-to here in Houston, Texas. That's Dr. Gail Henry. And by the way, here's full disclosure, right? I feel very, very competent in what I do, but I know when someone needs a little more in a particular area, then I always want to reach out to those experts. And Gail Henry, she's been providing great service in Houston for a long, long time for my patients. And she's definitely got that neurologic specialty.
Yeah.
We send to her people with stroke recovery and stuff like that. And she's magic at it, as I trust you are too, having studied under her.
Just quickly, I mean, this kind of toots her horn, but I was amazed by her simply because when first day I shadowed her, I walked into a room and the patient goes, are you here to shadow Dr. Henry? I said, yes. And the patient goes, good. She saved my life. I was like, okay, well, that's nice. That's nice of her. Go into the next room. Patient says the same exact thing. I go into the third room. Patient says the same exact thing. All day, every single patient was telling me how Dr. Henry saved their life. It was incredible. And so that's where I was like, I need to start paying attention.
Well, that sounds like as good an endorsement as you're ever going to get from anybody, anywhere, anytime. Yeah. So what was your top tip from Dr. Gail Henry? If you had to pick one.
She calls it the fountain of youth. So learning how to release pressure in T1, T2. So basically the upper thoracic, she'll call the fountain of youth. So she's like, if you can learn any sort of adjustments, it's going to be to decompress those areas.
Interesting. So keep in mind the landmark of chiropractic, it was called the hole-in-one. That was to beat the top vertebra, right? You want to get C1 just right. So that T1, that thoracic spine, that is certainly going to be this is just for our audience, right? You and I know this secondhand, but that's a transition segment where you change from one curve to another. That's a little challenging. T12 is another challenging one. And then for funny L5, S1, but those transition regions. But you know what? Of the regions to set, is it T1 that's tougher or T12 that's tougher? Depends on the person, but those are some pretty go-to areas.
Yeah, especially for breathing. Yeah.
What kind of magic did she have for that? Anything special?
It's just her adjusting style. I mean, she's just a great adjuster. She knows what she's doing. She's just, if you're your audience is familiar with chiropractors, a lot of people have had a bad experience and some people have had a good experience. And she's smooth and she knows how to set it up. She's been doing it for over 40 years. So just learning her technique was great because that's pretty much, I don't try and reinvent the wheel. I see my patients and I'm pretty much doing what she's doing.
By the way, my chiropractor friends that are watching this, I've taught chiropractors all over the world for 30 years. Instead of being a one-trick chiropractor, this is how I adjust, you like it, that's fine. Why not find the way that patient likes to be adjusted and have enough tools that if someone's very, very fragile and likes very gentle, you've got something for them. And if someone wants real vigorous, you got something for them. That's what I'm going to encourage everybody to do.
Yeah, I 100% agree with that. That's why I like the muscle testing. It's just, you get a great idea of where to start and pressures and So it's great. I'm with you.
So tell me about how you use muscle testing, right? One of my favorite tools. How do you use it in your neurologic setting to help you figure out what you're going to do and when you're done, maybe even?
Yeah, that's a great question. So ideally, I use it and I pair it with the functional neurology. So I will, I think David Traster kind of utilizes this too. But what I'm doing is trying to find a stressor. So something that's going to make them weak. Maybe it's a saccade or a pursuit, or maybe it's a tendon reflex, like just something that throws them off. And then I find something that fixes it. And so I'm just kind of trying to use my intuition the best that I can. If I find something and I think that this is something that I want to focus on, then that's what I'll dive into. So like I had a patient the other day where it's like, I can't remember if we did pursuits or saccades, but it's like every time she's looking to the left, things are shutting down. But all of a sudden, as soon as I do a tendon reflex on her left, she's getting stronger. So then I'll see that with the muscle test, and then while I'm adjusting her, like I'll integrate that as well. So before I maybe do a thoracic or a cervical or extremity adjustment, I'll tap on the tendon and kind of integrate that. I also use muscle testing to figure out kind of when I'm done, just to scan. Do we need to recheck the knees, the ankles, something in the neck or something? And then I also use it for nutritional too, so for clinical kinesiology. And then with sports, I was fortunate enough to be exposed to both Goodhart and Dr. Bueller at work as well. So he's testing like 600 muscles at a time. I think what's the guy in Utah? His name, Amit method. Greg Bueller, right? Yeah, Greg Bueller.
I'm thinking Alan Beardall is the one that
that's what I meant. Adam Beardall is the head guy with Goodhart, and then Dr. Bueller in Salt Lake City, Utah, is the one that picked up from Beardall. So thank you. Yeah. So I was fortunate enough to be exposed to both of those techniques. So when I'm working more with athletes, I am looking at the functional neurology, but I'm also trying to test like each individual muscle a little bit more specifically. And I'll do a lot more muscle testing there.
So let me build a bridge to our audience here. So a muscle test is just part of physical exam, and a muscle should work well regardless of the position you put it in. There are certain patterns that will have certain firing. Things turn on, things turn off. If you know the patterns, you know how to position it a certain way to see if something's firing appropriately or inappropriately. Certainly, if you can test, you can tell if something's strong or weak. Mm-hmm. And with kinesiology, we're always saying, what do we do to make it strong? Mm-hmm. Believe it or not, it could be even an emotion. It could be a chemical. It could be a reflex point. It could be a structural change. It could be an acupuncture point. There's almost no limit to it. Yeah. Here's what I've got to tell you. If you're watching this and this sounds foreign, it's going to be foreign if you haven't experienced it. But once you experience, you're going to say, wow, that's pretty fascinating. I think this is an interesting connection to my body. At least that's the experience I've seen for 33 straight years.
Yeah. Especially when you have patients that are very kinesthetic and very in tuned. Like if you start working on neurovascular points, like up in the head, they'll start feeling stuff. They're like, oh, you're pressing on the back of my head, and I'm feeling something release in my low back or something. Those people are usually a little bit more in tune with it. But and I try and follow that too. I always try and stick to clearing 5 areas, which is the acupressure, origin and insertions of muscles, the neurovascular, neurolymphatic, and then the adjustments itself. Because it's all important. It's just
we are profoundly similar. And by the way, if you're as a patient watching this and this sounds foreign to you, you haven't found a doctor that checks all those things.
Yeah.
Now, listen, I'm not saying we're the best of the best, even though if I found something better, I'd do it. But if you find someone that's moving you the way you want to go, keep going. If not, maybe try something different.
Yeah. And the motion's important too. And sometimes if I pick up, I feel like there's an emotion, then I'll use tuning forks. I like to use needling as well. So like I'll find, using the muscle testing, I'll find spots to place the needles. And then I just like to use the sound. I don't know if this has ever been researched or not, but I like to think that when you put the needles in and it's crossing the electrical barrier, which is your skin, and it's going into the fascia, which is high conductivity. Then when you do the tuning fork over, I like to think that the sound frequency is just getting more direct into the tissue. And I find that to work wonderful as well.
Well, I trust there is. Do you use a particular frequency on that tuning fork?
Solfeggio scales. So the solfeggio scales. So I'll work anywhere from like 174 to 9 something. I forget the scale. I can't.
Okay, so a whole variety is the bottom line.
Absolutely. Yeah.
So everything is energy. Einstein said that, and I believe the statement was everything is energy. and that's all there is to it, right? So if we add the right energy, and let's face it, it's all trial and error, right? I mean, if you have a loving energy coming forward, that should be well received and should be very, very healing. But sometimes you can have a loving energy like a tuning fork that's a little harsh for, let's say, a broken bone, right? That used to be a test. You put a tuning fork on a broken bone and they scream because, you know, you're really lighting that thing up. But we're talking about using vibration to heal. And as another avenue, driving it in deeper, I see the acupuncture needles as being such a good access to channels.
Yeah, 100%.
You ever do anything with moxa or cupping or anything like that?
A little bit with cupping, but not a whole lot. I like to stick with the needles and the tuning fork. Yeah.
Myself as well. You know, I've got acupuncturists that love cupping. I had acupuncturists that love moxa. If you don't know what moxa is, it's an herb that smells like marijuana. My first acupuncturist used to bring it in the office and people would go, "Hey, what's going on here?" Funny story. The first seminar I taught in Houston, Texas, we're going back to the 1990s. I had Jarod come in as the acupuncturist to teach acupuncture and moxa. He was burning moxa in a Hilton hotel. I had to go to the bathroom. I walk out inside. A couple ladies walking by. They go, "My God, who's smoking marijuana?" And the hotel manager said, "It's just some chiropractors having a seminar. Don't worry about it." So perfect story there, right?
That aligns.
So let's talk about performance. So, you know, you're generally in a position to help the person you used to be. So are you helping, specializing in baseball? Or are you going to other types of athletes as your specialty, or just general athletes?
All of the above, because human movement is human movement. You know, a bicep has to lengthen and shorten, a tricep has to lengthen and shorten, you know, your quads, you know, your hips. So all movements generally are the same. Now, I get there's going to be variance between person to person. But however, I find that if you can have the most basic isometrics or the most basic positions that you're holding, that tends to resolve the issues, whether it's the tightness, the weakness, the pain. And then also sometimes I think of it like a bodybuilder. Like a bodybuilder would be like, so I'm always looking at tone as well too, especially with online clients as well, because I can't always address them. So I'm always asking them, do you feel more tone in your upper bicep or your lower bicep? Do you feel more tone on like the high lateral quad or the low medial quad? And depending on where they feel tone, it's feedback for us. And so if there's no tone, potentially, like if they can't contract that area and there's no tone there, their brain might not have awareness of where that area is. And so then I might do a little bit more localized work. So let's take a quad, for example. Let's say if I have something, you know, we're all sitting here and I just say, okay, I want you to try and contract only your medial, low medial quad, you know, just right by the knee. And so you put a hand by the medial side, a hand by the lateral side, and your goal is to contract your quad and only contract the medial side. Can you do that? And if you can't, then maybe what we need to do is we'll do like a leg extension, but we'll slightly externally rotate the leg. And as we do that, that's going to force the medial quad to actually activate. So I'm also looking at that as well as, you know, kind of fine tuning it. If you were like a bodybuilder and you had to be like, hey, this muscle's a little shorter than, you know, this area, how would you engage that? Because when you engage that and you spend the time under tension of 5 minutes, your brain all of a sudden connects that area and pain goes away, your mobility increases. And so those are the things that I'm looking for as well.
I want to jump in some nuggets. So in neurology, there's something called the law of facilitation. The more you use a neurologic pathway, the easier it is to use it. It's like cutting a path through the snow for people that are listening. So the first time I tried to serve a tennis ball, God knows where it went, but suddenly you can do it with your eyes closed and hit so smoothly. Well, listen, we train patterns throughout our body. And like you're saying, for whatever reason, could be injury, could be just not developing the right coordination. Everybody has some level of muscle imbalance.
Yeah.
And very, very simply, the more balanced you are, the healthier you are, the fitter you are, the less risk of injury, the more out of balance, all the opposite is increased. So I love that you're actually having people perceive for themselves, because most of us will know, yeah, you know what, it is actually my upper bicep that contracts better. Yeah, it is my lateral quad, which is the more common pattern, right? And then, oh, by the way, my glutes don't fire at all. What's going on there, right? So, and I really like this idea of these long holds. One of the most powerful paradigm shifts I ever had was training with John Hines. He used to train Tony Robbins, and he'd have me hold 1 minute yoga poses, you know, with real hard posture. I'll tell you what, one was plenty. 5 minutes, wow, that's like putting that on steroids.
Well, and this is the beautiful thing about holding positions is that when you're holding the position and you're engaging your muscles, you're actually providing nutrients back to the area. So if you are engaging the muscles that are not being engaged properly, you're changing a compensation, which from my perspective is actually going to give you more energy. And so the idea is that when you're done holding the isometrics, if you've done them correctly, you should be able to jump out of a lunge. You should be able to dramatically push out of a push-up. And so that's another thing that I'm looking for. And so if you don't do it right, some people get stuck in the bottom of a push-up, or they get stuck in the bottom of a lunge. So I always like to look at it and I follow a lot on the perspective of water and water's memory and the fourth phase of water and energy, and even Dr. Jerry Tennett's work with meridians and stuff like that. Like the whole idea is that every time that you contract something, there's electrons being emitted. And so when electrons are being emitted, there's energy being created. So if we can create energy in the right way, we're going to be able to hold a lunge longer. We're going to be able to move better. And so in my perspective, it should actually get easier. And, you know, ideally that's what we're going for. I know 5 minutes seems scary, but it's like, it will get easier. And then you find another muscle that might not be working, and then you get that one going, and then you go through the whole process again. And so it's fun to me.
I like it. Although I need a little paradigm shift here, because when I hold a 5-minute horse stance, it takes an act of Congress to get me out of it. When I hold a 5-minute center split, which is not even close, right? I'm still 30, 40 degrees off the ground. Oh my gosh, when it's time to get out of that, I got to crawl out of it. So I guess I got things that need to fire more effectively.
So usually in those positions, especially the horse stance, you're looking for more of the hamstrings to pull you down. So you got to think about, you're going to take 5 minutes essentially to go from your top position to your bottom position, what might only be 2 to 3 degrees. And you're using your hamstrings and your glutes essentially to pull you down into position. And then right when you get down to that bottom position, now you engage the opposite, use your quads and everything, and you explode back up. So if you're only using your quads and not your hamstrings, then that's where the fatigue can get, because then when you're trying to pop out of there, you haven't actually used the muscles to lower you down. So the idea is that you're thinking about gravity. If I'm holding a lunge, grab in my front leg, the gravity is posing down on my front leg, so my quad is going to be trying to hold myself up. The idea is to teach your hamstring to actually pull you down into position versus your quad holding yourself up. That's the idea.
Well, and then if you use everything around the joint, obviously you're going to have more to use around the joint, more stability around the joint, more endurance around the joint, more strength around the joint. Yeah. I'm going to take one moment and go to our sponsor, bettercoffeeshop.com, the world's best organic coffee, 2 years in a row, reishi infused, alkaline, anti-inflammatory by at least a dozen different mechanisms. Bettercoffeeshop.com. I give a 100% money back guarantee. Buy a box. Let me know what you think of it. All right. So let's say that someone has, I don't know, you had back pain. So you use different postures. Is there a go-to posture? Let's go back. Let's go knee. Let's go shoulder, because those are three of my favorites and three of the world's favorites. Yeah, you have one favorite stance that you like for back pain?
One with back is a little tough, but I would probably say either the lunge or the wall. I got to say one. You asked for one. The first thing that came to my mind was wall sit, because that's probably the one that helped me the most. Okay. And with the wall sit, you're figuring out, again, how to engage your hamstrings to pull you down in position. It's also nice to have a wall because at certain times, some people have just a crazy anterior tilt in their pelvis. They got the huge curve in their lumbar spine. And so sometimes you can use the wall to kind of do like a low back press or something, like hit your lumbar spine against the wall, figure out how to engage the upper half of your hamstrings. Because that's another common thing is like people have back pain because I see they don't know how to create tone by their high hamstring. So essentially where the hamstring goes right into the glute, that area usually when they try and contract it is non-existent. And so when you kind of tilt the pelvis posteriorly, tilt back a little bit and engage the hamstrings, it helps activate that area a little bit better. So they're just recreating awareness. Essentially, just think of a chain. Like if you have tightness in your back and tightness in your hamstrings, but the middle has no awareness, these areas are going to be super tight. This is going to be super loose. So if we figure out how to connect the two, it balances out the pressure.
Well, that's the whole key, isn't it? Connect everything.
Yes, exactly. As beautifully said. And then for What would you say after back? You say shoulders?
Oh, I want to pause for a second there, because the way you describe wall sit, especially flattening the lumbar spine, and why stick there? Why not flatten the whole spine and get the shoulders against the wall too? That could be the best overall exercise ever. And I love how you described it that way, because I'll tell you what, I've been doing that for a long, long time. And the first time I tried to flatten everything against the wall, it's like, are you kidding me? Is that even possible? It was like the top 1 rep max, and I think it was quite good. So it's fitting along with what you're saying. Let's go to knees now. If you had to pick one thing for the knee,
I'll piggyback on you real quick there. That's what we call standing at attention, and so that would be like a precursor to wall sit. Essentially, is how do you stand, and then be like a sit to a stand. But standing at attention for 5 minutes every single day, if you do that, you might just get out of pain. You might feel better And what I also find too is when people fix their pelvic position, their rib cage pops up. So now they're starting to do a rib flare. So then they tuck the rib flare back down, and then their pelvis goes into an anterior tilt. And then maybe it's the neck. They'll tuck the rib cage down, and then their neck pops up. So it's just a balance. Everybody's different, but I like what you said. It's exactly what I'm looking for as well. You just want it flat against the ground. Knees. Best thing I would say for knees are probably. It's usually we got to engage the hamstring. So I usually like a glute ham machine. If you don't have a glute ham machine, you can do kind of like a prone glute ham. If you don't,
well, are you familiar with the term Nordic curl? What you're describing there is what they call Nordic curl.
Yeah, and just we would use a glute ham machine opposed to a Nordic, and you got to strengthen the hamstrings when it comes to the knees most of the time, not always.
So we're so much on the same page. When my Olympians pull hamstrings, that's my go-to: Nordic curls, Nordic curls, Nordic curls. Yeah. Let's go to shoulder now.
And sorry, one more thing on that. And then when you're doing the glute ham though, or the Nordic, I like to think of it because gravity, you're going down, it's going to be engaging the hamstrings. So you got to keep the quads engaged. That's how I like to think about it. So we're engaging the quads as we go down. On the shoulder, you said that, right? Yep. I would say the best is hang.
Okay.
Just either a dead.
Interesting. What hand position?
I would say it doesn't matter. You just start. Just start somewhere. And once you get there, then I like scap hangs. And so scap hangs is just you're hanging from the bar, and then all of a sudden you use your scaps to pull you up into position, keeping your arms locked down.
And how long can someone hold a scap hang?
I think the world record's like 58 minutes, if I'm not mistaken.
I don't think I've ever got 58 seconds. Wow.
When I first started, I was like 10 seconds.
It's hard. It's a hard hold.
I'm up to a little bit over 2 minutes, but there's a lot of people that in my circle who are doing one-handed 3 minutes, 4 minutes. So
I want to be in that circle. Holy cow. Superheroes and more. Is that the circle you run in? Holy cow.
Yeah. So I guess 3 exercises. There we go. You can either stand at attention, wall sit. Then we're going to look at either a lunge or a Nordic, and then you're going to look at like a hang.
Yeah.
Try and keep it really simple.
So, lots of different paths. After I trained with John Hines, I started doing yoga for a period of time, and there's yoga and there's yoga. I mean, the super strong holds that he was holding, you see how he could be a very successful strength and conditioning coach and everything else. Let's just go to neurology for a moment, because you spent a lot of time with Gail Henry. Any plans to pursue a neurodiplomate from Ted Carrick and the Carrick Institute or anything fun like that?
Yeah, I'm actively enrolled right now.
Good for you.
So I love how I got exposed to the clinical aspect first. It's like when you take anatomy and physiology, I feel like you should take kinesiology first. Like just understand how things move and work first, and then that kind of gives more meaning to when you start learning about the terms. So I appreciate my journey where I was involved in so much of the clinical observation that now when I go and learn the pathways, it makes more sense to me, and it means more. It's not just a name of a pathway that's connected to something. It's like, oh, I've seen how this actually applies, and I've seen it not work, and then I see it work with proper treatment, and that's just really cool to me.
It's cool to me as well. Well, this conversation has gone so fast. We're right at that magic 30-minute point, which is about what the listeners really, really like. So in wrapping up, any message you want to share with the rest of the world? What's Dr. Jarod Burton all about?
Yeah.
And how can we find you?
I would say the biggest thing that I like to help people do is just rediscover who they are. And so we all we all have an innate intelligence. We all have some sort of intuition within inside of us, and that's what I like for people to discover is to find their inner intuition and start speaking for themselves and learning how to heal themselves. And we're here to guide them, and ultimately the guidance is to get them to be able to be self-masteries, essentially. And so that's what I look for. You can follow me on Instagram or LinkedIn, a little bit on Facebook. I kind of post the same across all platforms. But besides the chiropractic, the biggest thing that I do is I work a lot with coaches. So I do a lot of educational with coaches. I help mentor them, just going through whatever they might have with their athletes or clients, whatever it might be.
Well, I think you've come up with something that's universally good and not too hard to implement. And as Warren Buffett said, simple has always worked for me. So I know your future is beyond bright.
Thank you.
I like to wrap up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.